All right. Hi, everybody. I'm Neil Parikh, Senior Medical Director for Oscar. I cover our care delivery vertical, which is, broadly speaking, where Oscar provides direct care to our members. Thank you again for having me and having Oscar as part of this event today. We're super excited to be here. Today, we're going to be speaking about a little bit about our care delivery strategy, and largely through the lens of telemedicine, but just understanding that telemedicine is just one piece and one component of a broader care delivery digital health strategy. So here at Oscar, we are a full-stack, direct-to-consumer health insurer. We take a lot of pride in the fact that we can call ourselves full-stack. Controlling our data allows us to set ourselves up for the opportunities to do more for our members in healthcare, and controlling our member experience, or having the full control of our technology, allows us to drive a much more seamless and fulfilled member experience. These two components, owning your data, owning the member experience, allows you to use engagement, marry engagement and technology to actually be able to direct members to high-value care, which is really the ultimate goal of a comprehensive care delivery system. So again, thinking about care delivery through the lens of telemedicine, it's really important to understand what the current landscape looks like today. And largely speaking, telemedicine is a transactional system. Most telemedicine systems out there deal with the common sort of 5 set of urgent care diagnoses and are largely based on a fee-for-service situation, focusing more on member convenience than necessarily focusing on the outcomes or being able to take care of that kind of member or patient in a longitudinal way. When we think about the opportunities and how telemedicine can drive better care delivery, we kind of break it up into these 4 buckets: member experience, value capture, comprehensive care, and operational efficiency. For the bulk of this presentation, we'll be focusing more on these first 2 buckets, member experience and value capture. Value capture largely meaning the opportunities you have when you have an integrated and comprehensive data machinery supporting your ability to outreach and connect with members. But I do want to just highlight a little bit about bucket 4, operational efficiency. It would really be a mistake to underestimate some of the challenges that go into developing the type of workforce required to support the type of care that you ultimately want to deliver. You need a dynamic, engaged, bought-in provider network that really thinks about care in a longitudinal way and not, again, that sort of transactional, fee-for-service, one-time, single-shot encounter. Physician behavior is a very critical component to being able to really push the types of outcomes that you're hoping for with your members. And the only way to really influence physician behavior is to have the type of culture that values, that prioritizes, what are our Oscar values. So when we think about member experience and we think about value capture, when you think about value capture, it doesn't really make a difference unless you can actually have an engaged member. And that is really where Oscar separates ourselves from other players in this field. Just take a pause here and think about this question. How often have any one of you called your insurance company with a healthcare question? I can't imagine. Oh, we got one hand. Well, for the rest of you, including myself, it doesn't happen very often. You don't really call your insurance company when you have a question about your own health care, or that of sometimes your family members. That happens with us. People come to us with their healthcare questions, which sets us up for a very unique opportunity to be able to direct and route them to the right places. And our data shows that we are actually doing this. The vast majority of our members have engaged with us through one of our digital platforms throughout their member journey. And when we think about engagement, should note that engagement is not, again, just through telemedicine, but through all the different ways that you can have an experience, that you can interact with Oscar, including our online accounts, our concierge services, and some of our mobile apps and mobile features. And when they come to us, we're then able to help steer them to the types of ways that we believe are value-generative opportunities in care delivery. Folks that interact with us through our concierge services are much more likely to use our telemedicine services. And when you engage with us through any of these digital entry points, you trust us to be able to help guide you to the right place within this healthcare ecosystem. The percentage of first-time visits routed by Oscar has gone up year over year. This is really a really important and telling stat. That means people come and ask us where to go see a physician and what type of physician to see, and we're able to help guide them there. Similarly, when we're able to help guide them to the right type of physician, we're able to capture more value in the system. Even within our narrow network, or our network, we're able to identify folks within the network that are able to provide higher value care and be able to guide folks to those people, which you can see on the right side of the screen. And one of the places that we're able to guide people to is telemedicine. And within telemedicine, because it is part of a larger, broader integrated Oscar ecosystem, our providers are equipped with far more information to be able to then serve a member in a more informed way. We have a huge data machinery that sits behind our provider team that provides information that's derived from claims data, pharmacy data, EHR data, sophisticated risk segmentation. We have a much more holistic picture of anybody who calls us, and therefore we can make a much more informed decision of what to do with that opportunity. And what to do may be, hey, you're the right type of person to go to the ER, or you're the right type of person to be, that we can manage and follow in a virtual way more confidently without risk of complication. And with that kind of information, with that kind of data, with that level of empowerment of our providers, we do have a lower referral rate. We have a better ability to make more informed decisions for our providers. For our members. And with that sort of trust, with that consistent member experience that happens and occurs throughout the Oscar journey, it naturally drives up more and more use of this type of delivery vertical. Year over year, we have more and more of our patients coming to us, or more of our members coming to us for their flu-like symptoms during the heavy flu season. And we have seen that year over year, we're able to resolve more flu cases within our members we're able to resolve a higher percentage of flu conditions year over year relative to what we are sending to in-person encounters. And that type of data visibility doesn't exist in a lot of other places. We're able to see this because we have a longitudinal view through claims of any of our members that come to us. Now, the data component is only one piece of the picture. The other major component to this is member experience, that first bucket that I was mentioning. And we believe that the member experience component to this is quite critical in both widening the funnel of what our members are going to eventually come to us with. And the critical component of our member experience is the seamless interactions with the rest of Oscar. Right here are a couple of visuals of what we call Doctor on Call, which is the ability to trigger a telemedicine encounter through the app. We spend a lot of time making sure that it looks clean, that it's easy to access, simple to use, and has a consistent experience start to finish. And as you can see, this is, and one of the aspects of what we also do is make available messaging back and forth with doctors through the app. This is just the start of how we think about offering different types of seamless, accessible experiences through the app, through our portals, for our members. The more that we can keep pushing down this frontier, the more that we know our members will continue to keep coming to us. And I think what you will see as we extend into the future of telemedicine is the interesting opportunities are how are you going to be able to connect these interactions with the other different types of ways that we can collect data about our members. When you think about wearable devices, remote home monitoring, PROs, all of that type of technology exists out there, but connecting it back to one consistent experience is the real opportunity, which we think we're really primed to achieve here at Oscar. So that second bucket, value capture. How do we use our data to do something different? And this is really what's quite distinct and exciting about our teams at Oscar. What I'm showing here is a historical look back at the different ways that members have engaged with us prior to a healthcare encounter, specifically in this case, going to the ER. And we were able to see in our data a variety of different signals that spiked in the week prior to anyone using an ER. Not a lot of folks have this kind of information or visibility into how their members utilize healthcare. And when you're able to stitch this type of information together, you're able to create a proactive outreach approach to be able to try to intercept folks before they have either an inappropriate or potentially another way that we can direct to a more optimal healthcare experience. So that's all I got for today. Thank you again for the opportunity to speak in front of you, and look forward to answering any questions during the Q&A.
Future of Care is New York City's premier community for healthcare innovation. To learn more, subscribe to our channel and visit our website at futureofcare.nyc.